Lucy Baker, the Senior Communications Manager here at Guilford Press, and I'm joined today by Stephen Rolnick, who is the co-author of our new book, Motivational Interviewing in Healthcare, Second Edition. Thanks so much for joining us today, and congratulations on your new book.
Thanks.
You're welcome. For those who don't know, can you briefly explain what motivational interviewing is and why it's so effective in helping people change behaviors like quitting smoking, their diet, exercise, medication adherence, things like that?
Wow. Yes, yeah, you're asking me to summarize my whole life in 1 minute, which I'll try. Okay. But this is actually two questions, not one. The first is, what is motivational interviewing? And I would say in simple language that it's a conversation that involves using compassion and curiosity to help the person clarify on why and how change might come about in their life, aided by your advice, your best advice, but not dominated by it. Okay. So even if this is literally just for like a minute or two, it's a very normal sounding conversation. It's free of prejudice, in which you speak to a person first, a patient second, and someone with strengths and dreams that could provide a powerful channel for their change. And the wisdom you assume is inside them about this. So how you hold this normal sounding conversation about change, aided by your advice, is what motivational interviewing is. It's a bit like dancing and learning to dance. You know, we can all dance, but with MI, it's just a matter of using familiar communication skills in a particular way, all designed to bring the best out of the patient.
That's so interesting.
So I hope that's reasonable. Your second question is, why is it so effective? Well, I've lost track, to be honest, Lucy, of the number of trials. There are currently over 2,000 randomized controlled trials, and I am not up to date with the literature in that sense. But I do think a certain truth emerges when I scan the studies and look at the abstracts, which is that it is a powerful and motivating experience for a patient to be asked by a practitioner, how do you feel about making this change? To be listened to as you speak for yourself about why and how you might do this. And I think what's going on is you hear yourself think aloud in the presence of this curious and compassionate person, and that promotes change. So I think that's what's going on in the literature.
The first edition of Motivational Interviewing in Healthcare was published in 2007. So a lot has changed since then, especially in the past 3 years. Can you speak to how the book is relevant today, especially given the challenges people are facing with the pandemic?
Yeah, it's a strong question, and it requires a clear answer. Certainly, when we wrote this second edition, we thought quite deeply about this. I tell you why, because the recent pandemic raises challenges for the clinician that go beyond vaccine hesitancy. In truth, people are facing isolation, distress, fear, and the breakdown of continuity in the treatment for those with existing medical conditions. So it's not just about COVID. And the poorer the neighborhood, the worse are these challenges. And then there's the subject of hesitancy about actually taking a vaccine, distrust in the healthcare system, and misinformation that is also flying around.
Right.
So how to address a subject like vaccine hesitancy in this kind of context is something that we paid careful attention to. and it's highlighted in a number of places in the book. And we've also devoted one chapter entirely to this topic.
That's great. Healthcare is a really broad field. So who do you see as the primary audience for this book?
Yeah, you're right. Healthcare is increasingly broad in the number of people and practitioners who get involved. It's obviously nurses and physicians. We've got them front and center in writing this book, but there are physician assistants, medical social workers, physical and occupational therapists, health educators, dentists, dietitians, behavioral health practitioners, administrators, and even managers. We've written a chapter in the book for them. So we're talking about a very wide range of professionals and paraprofessionals who are working on the front line of healthcare provision, including graduate students and trainees in all the fields I've mentioned. So what we've tried to do in this book is to present motivational interviewing in a way that will have all of these people look at the book and say, yes, this is my world. This speaks to my world. That was our ambition anyway. We'll leave it to you and the readers to decide whether we reached it.
I think you did. I think you did. New to this edition of the book is a chapter on making telehealth more effective. This is especially relevant now because virtual doctor's visits are becoming the norm. What are some other new additions to the book?
Yeah, virtual consulting we have tackled because it provides a great opportunity to practice listening skills, and MI can fit seamlessly into the telehealth conversation. We've witnessed that, and there's reasonable amount of research on that. Other new additions, merging advice giving with MI has been a pet subject of mine for many years, and so producing this book was a wonderful opportunity to have a chapter on that subject. It can be done. So you can be both an expert and an MI practitioner at the same time, and that's been a revelation of sorts for us. Other chapters include topics like MI in groups, education groups in healthcare, other kinds of groups, the very brief consultation. How can you possibly do this MI if you've just got a minute or more? These are the sort of topics we've tackled. And then finally, we took a big risk. We ended the book with a deep dive into what an MI consistent consultation looks and feels like from our own experience. And that's a more personal little ending to the book, which I hope people will enjoy.
So lastly, we'd just like to learn a little bit more about you on a personal level. When you're not working, what do you do for fun? And are there any projects coming up that you're really excited about?
Wow. Yeah. Well, I don't live in the United States. I grew up in Cape Town, South Africa, and I live in Cardiff, Wales, in the United Kingdom. I've traveled and worked in many parts of the world. But then about 10 years back, I retired and from my university job, and decided I wanted to write a book for school teachers, how they might use MI in the classroom. So that took a few years, did that, and then I started having the time of my life, the best time of my life, which is I decided to explore writing a book on MI for sports coaches. And I've been doing nothing else since. So I work mostly in sport at the moment, and I'm really enjoying it, and produced that book, which feels like it is a contribution. What next? I'm tempted to do my next book on MI for parents. I'm very tempted. But if you ask my 4 kids, they will throw their heads back and they'll laugh and they'll say, oh, no, not you, Dad, stop it. You know, in any case, you're hopeless at using MI at home and those sort of jokes. But so they'll probably advise me to spend more time in this little oak woodland that we've got, which is another passion of mine. So I look after trees in this forest and that sort of thing. Yeah, so that's me.
Great. Thank you so much for joining us today. This was really interesting.